The Replay Club is $10 a month, and you get the full recording of what you saw tonight. You get all of the handouts. You get the transcript. There's a full word-for-word transcript, so you can print it out, and it's all in the same member area where you would if you were a student of ours. So it's very convenient. You just go into, and when you become a Replay member, not only do you get the current months, you get all the previous months as well. So it's a good value.
This is Boyd here at just slightly after 8 on August the 23rd for the August 2012 Coding Certification Q&A webinar. And we want to welcome everybody. With me again are Laureen Jandroep and also Alicia Scott. Hello, everybody.
Hello.
Hello. Look at all those different states. Pennsylvania, Florida, Maine, North Carolina, Montana.
Nice.
There was even somebody from El Paso, Texas. That's not too far. Oregon, Fort Worth. I'd like to see the Arizona, Philadelphia.
All right, then we'll get started because there are some meaty questions in here. I think one took me a record 2.5 hours to prepare, so you guys are really putting me through my paces here. First slide is about the goals of the webinar. And I see a lot of frequent flyer names on here, so I'll go a little bit quicker. We want to answer your coding questions. These are not ones that Alicia and I, sit around and come up with. They are questions that are asked from our students, from our Blitz customers, on our new discussion forum. So, they are general coding questions, and they are related to taking the board exam. So we have a mix. So the idea is to support our existing members and customers and students, but also to let people who are just getting to know us see what we're like as instructors, see how fun we are, so that you want to learn from us. And also, what's a big event on this call is at the end we do a giveaway. We give away one of our Blitz video packages worth $240, or if you're already certified, you can choose one of our CEU packages. All right, the first one, this is the 2.5 hour one, coding cardiac caths. Seemed like an innocent little question. So I need help in billing cardiac caths. I'm new to cardiology, and she gives 2 patient examples. So what I want to do is teach what cardiac caths are, and then go and try to answer the questions. So let me click on my little answer sheet, and hopefully that will pull up correctly. Yeah, we had to go to making separate sheets to do the answers for your questions because it's just so much, we can't fit them on the slides. So here we go, coding cardiac caths. First of all, when I teach this to my students, I make them stop a minute. We hear it all the time, but sometimes as a coder, we need to stop and ask, well, what is it really? What are they doing? And it's a diagnostic procedure. They're not trying to fix anything. They're trying to diagnose a problem. And the way they do that is with imaging. They want to take a picture of the heart. And in order to get a good image, they need to get dye going through the vessel so they can visualize that. In order to get the dye in, they got to put a catheter up there. Okay, so if you can keep that in mind, that will help you. I did find really 2 excellent YouTube videos that are designed more for patients who are about to get the procedure, but very, very visual. I will invite you to go ahead and click on them, even if you go to YouTube and just Google cardiac catheterization procedure. I'm not Google, YouTube. And for our Replay Club members that get the handout packet, this will be hyperlinked and you can go check it out. So prior to 2001, when you coded a cardiac cath, you actually needed 3 codes at a minimum. You needed 1 catheterization code to say if it went on the right or the left. You needed 1 or more injection codes, because wherever you inject a dye would get a code. And then 1 or more imaging codes. Where did you take images? Was it of the chambers of the heart? Was it of coronary vessels? So in 2011, they came out with packaging these cardiac cath codes. So what you need to actually go in and abstract for when you're looking at a cardiac cath report is, was it for a congenital reason or not? Because that's going to change how you do your coding. That's the number one thing you need to figure out. Then you need to figure out which side of the heart was catheterized. Was it the right, the left, or both? And then the last thing was, are there any add-on procedures that were done that you're allowed to code as well? So for my day job, I had to update these codes in 2011. And so I was like, as I've said many times on this webinar, I'm a very visual learner. And I was reading all the changes and I'm like, I'm not getting it. So I had to make my little chart. So I'm going to share that with you here. And by the way, CPT has their own chart on page 493 to 96 if you have the professional version. But for me, that wasn't working. It was on 4 pages. It was unwieldy, and it wasn't how I thought. I wanted to start with the way the reports often start out, which side are they doing the catheterization. So that's what I look for in the report first. Is it a right heart cath only, a left heart cath only, or a combo?
This is a HCPCS code, J3301. They were having problems with it being rejected. This is actually for catalogs. If you hit, I don't think I can I hit that?
No,
okay.
Sorry. You were trying to do it, weren't you?
I was thinking, wait, that doesn't work. Oh, no. What catalog is triamcinolone cream, or not cream. I think triamcinolone cream, you can get that over the counter. You may know what that is or not. But getting reimbursement for this code can give you some problems. We saw several things pop up in some other forums about people trying to get payment for that. One of the things you need to note, though, is that this is an injection you cannot get paid unless you also use the administration code. Now, not knowing which administration code you're going to use, you might use 96372. I had a student that actually uses this code, and she said a few times they've tried to submit it and they left off the administration code. They always use 96372. She's got it memorized now because they use it so often. But make sure that you include that. Oh, right. Medical coding for pregnancy. That's right. I really like this because this is one of the most common questions that I get when I'm teaching. Pregnancy can be really intimidating because there's so many codes that are involved. One of our PBC students had stated, how many codes do I need when I code a pregnancy and delivery? This continues to confuse me. I think I have all of them, and then when I check my answer, I've missed one. And if you click on that answer, I've got a scenario that's actually in the Carol Buck books that covers several. When you're dealing with pregnancy coding, the first thing you need to determine, the mother's chart or the baby's chart. Now, once with pregnancy coding, you would be thinking, okay, well, pregnancy isn't the baby. But as long as the mother is pregnant and has not delivered, everything that happens to the fetus or the mother gets put on the mother's chart. Then once the baby is delivered, you have a newborn chart and things get separated. That can confuse people sometimes as well. So make sure that you're in the proper chart. Some of the key terms that you want to look for when you go to code pregnancy: gestation, cesarean delivery, vaginal delivery, and if it was a viable or a living infant. You'll see both those terms. Okay, this is one from the textbook that we use, the Carol Buck books that we like so well, the step-by-step. Mrs. Smith is a 32-week gestation, and I highlighted all the terms that you're going to pull out of this, and is admitted with a severe bleeding with abdominal cramping. An emergency ultrasound is done and fetal monitors are applied. She's diagnosed with total placenta previa with indications of fetal distress. An emergency cesarean section is done with delivery of a viable male infant. So I broke down the codes that you would use for this. This is actually in the ICD-9 section of our book, but I went ahead and pulled out a CPT code. And when you're doing CPT codes for delivery, it's a cesarean delivery only.
Okay, colonoscopy screening. How come I get the fun ones? All right, so the question is, doctor sees the patient in the office for screening colonoscopy. So they're like, is it V76.51 or V76.59? The doctor spends about 15 minutes with the patient, and then we go in and spend another 10 minutes explaining prep to them and signing consent. So they're upset. Now Medicare wants you not to be paid for that office visit. Is there a special code to use? Give me the secret. How do I get that office visit paid? So you might not like my answer, but this is what our research showed. And, basically we do these answer sheets. They're like a scratch pad. It's just, what we encourage you to do to be your own, researcher. And I used to do a session on that at local AAPC chapters on how to be your own consultant. Maybe I should bring that back and show people how to look up things like this. So at any rate, colonoscopy screening. We need to look up these two codes that she referenced. V76.51 says screening for malignant neoplasm of the colon, or it could be screening colonoscopy not otherwise specified. V76.59 is screening for malignant neoplasms other sites. So the answer, because she said it was a colonoscopy, is going to be V76.51.
The future of ICD-10. I know that everybody gets really nervous when they hear about ICD-10. Actually, if you're a student now, I think it should be kind of exciting because you're right at the beginning of history, I guess you could say it. But two things. There's going to be a lot of people that are coders or have been a coder for a long time, and sometimes you don't stop coding until you die because it's something that you can keep going. Well, ICD-10 is going to change some of that. Some people are going to say, you know what, I think I'll retire. I don't want to learn something new. So for all of you new coders, this is a really great time for you to get into coding. But it's not going to be so scary. When should you start to study for ICD-10? Is there anything I can do now to get ready, or should I wait for everything to switch over? What I would tell you is start getting used to relearning your AMP and your terminology. What ICD-10 actually has done is one of the ways they've made it easier for the coder is they've expanded the descriptions. So if you had one code for a procedure, say a fracture of the femur, and so you would say fracture of the femur, open or closed. Well, so you would have two code choices. Now you're going to have maybe 4 or 5 or more because they're going to say fracture of the femur, open or closed, medial, distal, the little protrusions or the bones off the little curves off the top ends of the femur that look like little balls. Those have a name, and I can't remember off the top of my head what they are, but if it's close to that or that part of the femur is broken, it's going to be labeled that, whereas before you had 2 choices, fractured femur, open and closed. Okay, I'm confused about the difference between etiology and manifestation codes. What is the difference? And do you know have any examples? And we just happen to have that. This is basic for coders. You don't probably really think etiology and manifestation when you're coding, but what's the first you need to know is the guidelines. Etiology is telling you what the patient has wrong with them. Manifestation tells you how the etiology is presenting. So an example of that, 250, that's the diabetes with mellitus. That's the etiology. That's what the patient has. And keep in mind, diabetes codes always have 5 digits, the 250. So they do trick you on the test sometimes and leave one of those digits off. Okay, so let's say our patient is 250.1. That's a type 1 diabetic, and it's under control.
Medical decision making. This is from one of our Blitz video customers. Hello, very helpful EM video, but I noticed that you didn't emphasize to write the CMS risk data table for MDM in the CPT book. Is it because there's a simpler way to figure out the level of MDM, or is it because the level of examination and determining the PFSH are the only things you need to figure out the correct code? So E&M coding has evolved on the board exam. The CMS risk, I put a hyperlink here to show you what that looks like. This is the table of risk. And yeah, if you want to write that in your manual, go ahead. You can write anything you want in your manual. You cannot print this and tape it. That is not allowed. The reason why I don't recommend it is because there is a table that I believe that they will use more on the board exam. So let me show you now that I got my document camera working. Yay! What I teach my students, or those that purchase the E&M CEU webinar, is to locate your hem and time, is my little rhyme here. So where's my little pointer? Okay, well, I have my nails done so I can use my fingers. Okay, so you have locate your hem and time. So H is history, E is exam, M is medical decision making. So in the board exam, your job is trying to pull out that information from the note.
Okay, late effect guidelines. How does a coder determine and sequence late effects and principal diagnosis in ICD-9? This is probably a very basic question, but as a rookie coding student, it's confusing to me right now. Well, it's confusing to everybody, so don't feel bad. This is probably one of the first guidelines that you get taught in most coding courses, and it just baffles everybody. So let's look at the little answer sheet we created for you.
Find a code. This is for you. It's just a benefit for our members that findacode.com gives us. If you sign up for Find a Code, you can save, I think it's $60 a month. I mean, a year. And you just put in CCO in the promo code. So findacode.com. And findacode.com has free ICD-10 lookups, and you can map it from 9 to 10. So check it out. And it's free. The part you have to pay for is the CPT and HCPCS access. CEU Webinars, modifiers, E&M, and you just go to the site, products, or go to CEU-Webinars. The Review Blitz videos are our flagship product. This is what we started with. It's a 6 DVD set, or online, or both. So to try and help people out money-wise, we used to charge $240 for the set. That's still available. But if you can get away with just one, then it's only $179. All right, so let's do a free drawing for that. Do we have under 100 people?
Yeah.
Oh, wow, that's a record. Woohoo.
It is.
All right, so here we go. 1 to 100, generate. Number 42.
Jennifer Thompson.
Jennifer, congratulations.
Karen asks, is there a good way to code for physicals on Medicare patients? For example, Medicare does not cover physicals, but doctors don't seem to understand this.
Well, a physical, yes, there are E&M codes for that. I'm going to show you a super duper secret trick here. And it's because that I've learned how to do internet marketing. Boyd probably knows this trick. So you want to be your own researcher, your own consultant. This is how Alicia and I do it to get ready for this call. So the question was about physicals, right? Coding physicals. So you put that, oh, I got to go to Google. So you type in what you want.
Medicare physical.
Medicare physical. Okay. Thank you. If I can spell. And then you could just search for it that way, and it'll bring up a whole bunch of sites. Or if you know what you want is on a specific site, and I do this a lot for aapc.com, and you'll see other coders talking about, here we go, Medicare annual physicals. So what I would recommend is, if you could go to the forum that Alicia was telling you about, and let me show you that. It's under the community tab, and post that question, and we'll develop it just like we're doing here, and we'll go research it, and we'll present it in a nice pretty package if you don't have, if you don't want to go try and do that yourself. But here's where you enter your Q&A webinar questions. And so now we're going to go in, and the ones we answered tonight, like this one, late effects, the J code, now we'll go in and we'll mark them answered. And there's room for plenty of more people to come in here. If it's something that we don't feel is great for the webinar, we'll go ahead and answer it, and it'll be right here for you. Okay. So
the other thing to mention too, Laureen, is that if you do post if you're not sure, post them in here anyway, because it may be something that you'll be able to help somebody else with, or somebody else will know the answer and they'll post under that for you. So you're not just talking to us, you're talking to everybody else that's accessing this.
Yeah. And we just launched this, like, what was it, 10 days ago, and we've already got 300 people. All right, great. Well, thank you, everyone. It was a great session, and just spread the word. Come visit us on the website and comment and all that good stuff. That's the best way to to show us that you like what's going on here. Happy coding!